was 1 year ago today that the U.S. recorded our first coronavirus case. The patient was a man who had traveled from Wuhan, China to his home in Seattle. Since then, we've had 25 million cases in this country and 405,000 American lives lost. Our Kayna Whitworth was there in Seattle when the first patient was diagnosed, and she joins us live now with more. Hi, Kayna. What was it like to be on the ground there as this was all unfolding and that virus was brand new?
I have to tell you, Diane, it feels like a lifetime ago that happened. And I remember my producer, Jenna Harris, and we got on the ground and we went running right away. And this healthcare team there in Seattle, they were prepared, right? They have this one patient and they were prepared to handle this one patient. They went to his house. They picked him up in a specialized vehicle, one that they would use to transport somebody that had, say, Ebola. Brought him to the hospital, put him in this biocontainment unit that they had in the hospital. They had one of those. And this single patient had the care of 4 specialized nurses around the clock. They were using a robot to help treat this patient. It was really unbelievable. And this was a patient who the doctors there told me if it wasn't coronavirus, he could be at home right now using Tylenol, that he would be relatively okay. And one thing that when I went back, Diane, and I was looking through my notes and my emails of our coverage there, this really stood out to me. We were waiting for the World Health Organization to declare this a global health emergency, and they didn't do that while I was there this time last year. That didn't happen until some 20 days later. And they were telling us that they had a team on the ground. They say that we have stressed that by having, they had a team on the ground in Wuhan, to be clear, that by having a strong action, not only will they control the outbreak in their country, but they will also minimize the chances of this outbreak spreading internationally. I mean, it's unbelievable for me to read that and to know, Diane, that at that time, it was already spreading throughout our communities, threatening the lives of millions of Americans.
And now here we are, over 400,000 Americans' lives lost and counting. Now, Dr. George Diaz of Providence Medical Center in Seattle, he treated that first patient. And Kayna, I know that you spoke with Dr. Diaz last year. What struck you most about him then and hearing him now?
Well, you know, he had a lot of confidence at the time because they had the ability to treat this one patient. They felt like they really had control over this situation. And I'm looking back through, again, some of our conversations. And one thing that I spoke with Dr. Diaz about was the screenings that they were doing at the airports. If you remember, they were funneling anybody traveling from that region into the United States through 5 different airports. And they were doing temperature tests on all of those people. And I asked him, you know, how effective do you think those screenings are? And his response to me, I have it here, was, well, when someone develops symptoms and are likely the most likely contagious when they're symptomatic, he said those screenings will be very effective, a very effective way of determining who is really at risk of having an infection and who is really at risk of spreading it. I also spoke with the county health officers up there in Seattle, Diane, and he told me, I humbly think it's inevitable that additional cases might find their way into this country. I mean, it is just, it's so hard to look back and think about the confidence that they had, and perhaps we were just all really naive about it. To be honest with you, Diane, I wonder, was I asking the right questions? Was I holding our health officials accountable at the time? I question that about myself all the time.
I think we're all in a position of thinking, you know, when you think back a year ago, if only we knew then what we know now. But of course, there was no way to do that, and all we can do now is learn from what we have learned in the past year and try to move forward in the best way we can, both us as journalists and, of course, our leadership in this country. Kayna Whitworth, thank you as always.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.